Good evening, and thank you for the opportunity to share a little bit about the work we're doing at Health Quality Ontario in partnership with the Ontario Neurotrauma Foundation. So as Carmela said, my name is Tanveer Singh. I'm a quality improvement specialist at Health Quality Ontario, developing the concussion quality standard. Judy, do you want to introduce yourself? Okay. So maybe we'll just continue. So today I'm going to give you a little bit of an overview of what we're working on with the quality standard. So I'll start by telling you a little bit about what the quality standard is. We'll go into some data and information about why we really need this quality standard, how we plan to measure and measure success of the quality standard, and finally I'll talk a little bit about the quality statements that make up the quality standard as well as the scope of the standard itself. So what is a quality standard? So Carmela talked about it a little bit already. So quality standards are a set of 5 to 15 concise statements that describe what care should look like for any given topic where there's a lot of variation in the way people are receiving care in Ontario. So Carmela mentioned several other topics that we have, and I think we have approximately 20 quality standards currently published on our website if you'd be interested in taking a look. And specifically, we're working on the concussion quality standard now in partnership with the ONF. So what are the aims of the quality standards program? So ultimately what we want to do is try and improve care across the province and ensure that anybody with a concussion in Ontario is receiving the same kind of care and the right kind of care. And what we try to do is we try to sort of address different parties throughout the system by ensuring that patients, families, and caregivers can know what to ask for in their care, perhaps use the quality standard as a tool to advocate for the kind of care that they should be receiving, but also help healthcare providers know what to provide or what care to offer. We also want to help healthcare organizations in the system more broadly measure, assess, and improve the quality of care that's being provided. So when a quality standard gets released on the website, it comes with a sort of package or suite of additional other materials. So you'll see a bit of an overview of what they look like on the slide. There's the quality standard. This is an example, by the way, of the major depression quality standard, which is already on our website. And the quality standard itself is made up of 5 to 15 statements. For concussion, we have 6 statements. That's really where we describe what care should look like. And then we also have a patient conversation guide, and that's where the information in the quality standard is geared towards patients, families, and caregivers. And it also includes some questions that people might be able to take to their healthcare provider and ask. We also have a Getting Started guide. So the Getting Started guide is an implementation tool. It can be used to for healthcare organizations to look at their care setting and say, okay, what's the priority for me? What quality statements should I be focusing on in terms of making improvements? What are my biggest areas for improvement? And then using the Getting Started guide as a tool to go about making that change. There's recommendations for adoption, which are system-level recommendations that try to address any barriers that might be in the way of high-quality care or providers being able to provide high-quality care. And then we have a number of data and reporting products, including a measurement guide and indicators. So I'm just going to hand it over to Judy, who's going to tell us a little bit about why a quality standard for concussion is needed.
Thank you very much, Tanveer. So obviously we could talk a long time about this, but as you've heard from some of the other speakers, Dr. Rattan talked about some of the challenges that are out in the world for managing and diagnosing concussion. Dr. Snyderman talked about the need for prompt follow-up. Kanika talked about outdated advice being given and some of the challenges of how advice changes. And so when we put all this together and we look at the incidence of diagnosed concussions in Ontario, this isn't actually a small problem. 157,000 new concussions every year in Ontario. This is a pretty significant number. And as Dr. Rattan said, if about 15% go on to experience prolonged symptoms, that's about 23,000 people every year in Ontario who will go on to experience prolonged symptoms. So there's definitely a need to make sure we're doing something right in terms of the diagnosis and management of concussion. And so when we talk about prompt follow-up, I think if I had more time, we'd play a little game where you told me how much time would be a good amount of time before you needed follow-up, and we'd go back and forth. But we don't have a lot of time. So most people would say that 2 weeks is about a good amount of time where it would be great if you had follow-up with your family physician. And so 2 weeks is that black dotted line really close to the bottom of this graph. So you can see that there's a lot of people who are waiting a whole lot more than 2 weeks to get that follow-up with their family physician. And this data comes from the concussion cohort, there's a paper that's recently been published in the Journal of Head Trauma Rehab. Laura Langer and her colleagues have published that paper, and this data comes from there. So I think this is indicating that we do have a little bit of a system-wide problem when people are not being pointed towards their family physicians for follow-up. And we can, again, if we had more time, play a little game on why we thought this happens. But there's probably a number of reasons why this delay occurs. Now, if you are part of the 23,000 people a year who go on to have prolonged symptoms, you may need to have a referral to a specialist. So if you think about it, referral specialist, how long is that going to take? Most people say somewhere in the order of 6 weeks, okay? So the line here is at 2 weeks, but let's just, for the sake of argument, look at the number 50. That's a little higher up there. So this is 50 days. Well, this is kind of depressing when you look at this because 50 is pretty close to the bottom. So there's a whole lot of people who are waiting a really long time to get access to specialist care for their prolonged symptoms. And there's a whole bunch of reasons why this might be the case, and some of it may be the poor follow-up so that the referrals aren't being made in a timely manner, as well as it could be access to these. So this is a sort of a snapshot of the reason why we think we can do better in terms of getting those clear messages out about what quality care looks like, what quality diagnosis and trajectory of care looks like. So after all of this, we're going to do all of the work. We're going to release the standard. And how can we measure whether we've made a difference? And so we are in discussion as a group with trying to decide what the best way of measuring success is given the constraints we have in our healthcare system. And so this is an example of some of the ways that we're thinking about measuring success. So there are provincial indicators where we would look and see if we think we're doing a really good job of coding and identifying people with concussion. If we're doing a good job telling patients about a trajectory of care, what they can expect. And if we're making sure people are getting referred to specialists in a timely manner. So this is just a couple of examples. Now I'm going to throw it back to Tanveer, who's actually going to give a quick summary of the quality statements.
This has to come really low for me. Okay, so just in terms of what's in scope for the quality standard, so based on the availability of evidence or good evidence, we're focusing on people who are ages 5 years and up, so it includes children, adolescents, adults, are all included as being in scope for the quality standard. We are also including sort of all areas of concussion care, including assessment, diagnosis, and management of acute concussion and persistent or prolonged post-concussion symptoms. And the concussion can come from any cause. It can be in any care, it covers all care settings as well as all healthcare providers. So the quality standard development work is heavily supported by a quality standard advisory committee, and you'll notice that some of the people from the committee are in the room with us today. The co-chairs of the committee are Carmela Tartaglia and Carol DiMatteo, and there's an infographic on the slide here which describes the representation of different professions that we have on the committee. We have representation from several different professions, but also importantly to mention, we have people with lived experience on the committee to give their perspective as well on the quality statements. There is a full list of our committee members available online if anyone's interested in taking a little bit more of a closer look at our committee. And just in the interest of time, because I have 5 seconds left, I may not go through the quality statements, but you'll see the topic areas here. Here are the 6 quality statements that were prioritized by our committee as being areas of focus for the quality standard. So this kind of describes what we cover. So really quickly, the diagnosis of concussion, education, self-management, and support for patients, families, and caregivers, the acute management, follow-up and management of persistent or prolonged post-concussion symptoms, timely access to specialized interprofessional concussion care, and education and training for healthcare providers. So there will be a draft of this quality standard posted online on the Health Quality Ontario website for 3 weeks in January. That's where you could take a closer look at what each statement says and what they're all about. And we open this period up in January for 3 weeks for a public consultation. So we would be very happy to hear your perspectives on the quality statements, any areas where you feel like there's improvement needed. So this period of time, if you do want to be added to our stakeholder list, come chat with me and I can make sure that your name is on our list so we can make sure you get an email when the draft is posted online. And finally, we are aiming to launch the quality standard next summer of 2020.